Injuries at the beach are relatively common. This morning we start a first-part summer series, and the doctor is in to discuss different types of injuries that can happen while at the beach and some of the treatments available. Good morning, Dr. Vijay. How are you doing?
Very well, thanks.
You know, let's start with jellyfish or stings.
Sure.
And when does someone know they're stung? And I mean, do you know right away?
Oh, you know right away. Yeah, you know, jellyfish, and certainly there's something called a man of war. Both of these organisms hurt when they sting, so there's no question. As soon as you sting, you know you've been stung, and you know where you've been stung.
Okay.
And in general, you can come out of the water then, pull out the stingers and apply first aid.
What should you do after you're stung? Do you need to go to the hospital?
You don't have to go to the hospital right away. Certainly what you need to do is have some vinegar handy and some clean soap and water if you don't have that. Wash it very carefully and make sure you're not having any further reactions. If the pain resolves and if you don't have any redness surrounding the area or significant pain, then you don't have to go to a physician. But if you have either significant pain or some redness or even persistent irritation, it's important to get seen by somebody.
And you know, when you're at the beach, you're enjoying the day, you're out there for several hours, it's important to put that sunscreen on.
Absolutely, absolutely. You know, we talked about that last week. Sunscreen is very important for us, especially, you know, all over South Texas, because if you get too much sun, then you get sunburned, then you have a risk for skin cancer. Of course, on the flip side, you need to get some sunlight so you get enough vitamins in your body.
And of course, with those jellyfish stings, everyone's out there with bare feet running around.
Right.
You can also get cut.
Yeah, you can get cut. You know, there's oyster shells, which are extremely sharp as razors actually, and you know, various other rocks and things that can cut you and expose you to bacteria that may be in the water.
And you know, one thing you were talking about that I didn't know is that the bacteria levels in the water are actually monitored, and people need to pay attention to that.
That's right. That's very important. We have something called the Texas General Land Office, which actually monitors our beaches all over Texas, all over the Gulf Coast. And during the summer months, I think it's from May to about August or September, they have people or agents measuring the bacterial counts in the water once a week. And the rest of the year, they measure it once every 2 weeks, except for spring break. And it's important to check this because the bacteria they're checking for is for something called fecal coliforms, which basically fecal bacteria, which is present in all water, but when the levels cross a certain amount, it's best not to go to those beaches. So if you check this website before you go and make sure that the bacterial count is low, then you can go there freely and have a good time.
What is that website one more time?
It's called TexasBeachWatch.com. Real important to go before you go. You'd be surprised. You know, there's beaches in Nueces County that you shouldn't be going to, Aransas County that you need to be careful about. Certainly the issue is that if you get in the water and there's fecal contamination, you can't help but ingest some water when you get in there. You don't want to contract any illness that reminds you in a bad way about your trip to the beach.
How sick can you get from that?
You can get pretty sick, you know, sick enough to require medical treatment, if not hospitalization, depending on the kind of infection that you contract from the water. So real important to see that website and check it out.
Something else to keep in mind when you're going to the beach, dehydration.
That's right, that's right. You want to make sure you go with enough fresh water with you, some food, and once you cross a couple hours, especially in the hot months, you definitely want to rehydrate, stay away from the sunlight, but before you go, check that website.
All right, thank you very much, Dr. Vijay. Remember, the doctor is here Sunday to answer all your medical questions, so if you have a topic